I had just finished my PhD. My PhD was in molecular biology, insulin signaling and insulin resistance. And at that time, I was a clinical teacher in the internal medicine ward at the University of Campinas in Brazil. And I was living a very happy life, like doing research, doing clinical tasks, having small group learning sessions with students. But then I had this trouble. Are there any deans here? Deans are those kind of people that can make you feel important, right? They come to you and they say, Marco, yeah, you are a nice guy. You are a nice teacher, man. We need you. Yeah, it's a small job. You don't need to mind. And I have to tell something about Brazil to you. Brazil is not a country for amateurs, right? We are all the time with, now I learned that we have this style of communication that is called high context communication. So yes can be maybe, can be no, no can be maybe, and can be yes. So I follow the theme in this idea of dealing with this. So the dean invited me to be the head. You know, I was 32 years old. And then when you use the word head, you'll be responsible. You will have freedom and autonomy to do whatever you want. Huh? Can you feel it? Huh? Yeah, that was the discourse to attract me to this. And, well, the job was you need to teach at the emergency department, at the emergency unit of our hospital. And it was considered by the interns the worst rotation in our internship. I became, from one day to the other, the responsible for different learning environments. Like, this is the observation unit of our emergency department. We have place here for 25 people, but we end up with 100 sometimes. Sometimes to see one patient, I have to move 2 or 3 beds to get there. It's an internal medicine ward with 100 patients in a corridor. This is our emergency room. We have space to take care of 1, maybe 2, but sometimes I have 7 patients at the same time. So I'm putting a central line, then I am intubating a patient, then I'm putting another central line, and we have students, residents, all over the place. We also have an outpatient clinic. We see 300, 400 patients every day. We have an ICU, that is an ICU only for the patients from the emergency department, 20 beds. And we also have an internal medicine ward for the acute patients that have the lucky to be a place to get inside the hospital. So can you imagine that? Four different learning environments with residents and interns. And I was the only official clinical teacher. So I said, well, how can I be in all that places at the same time? And the big problem that I decided to tackle that I had to deal with different problems, but this is the problem that we are going to address here. That is the lack of engagement of students. Because for us, clinicians, it was a challenge to be able to behave as a professional in this environment. But for the students, it was even more challenging, right? To interact with nurses, with colleagues, with patients, to do the clinical job, to deal with the hierarchy. When you have chaotic environments, hierarchy tends to become higher, right? Because you don't have time to negotiate all the decisions that you are making. So it's much easier to become a kind of dictator in an environment like that. And we deal with high performer students, so all of them are afraid of failing. So all those elements together were creating this situation in which students were not interacting with us. And if there are clinical teachers here in the audience, I think that you recognize that. You are there in the morning, 7 a.m., starting the round, and then you start with very easy questions in the round, right? Because you want to get engagement. And even with very easy questions, the students keep watching at you, looking at you like they were in another planet. And we were not able to engage those guys in a meaningful conversation during the rotations. And there is also another problem in Brazil. We have a high percentage of students that at the end of the course, they go directly to clinical practice. We don't have enough places for residency training for all of our students. So 30 to 35% of the students, they will go directly to practice without residency training. And those guys, they end up practicing on clinical, emergency departments and primary care facilities. So it's really important for them to learn what we have to teach, because they will become the emergency doctors of the country. Even the ones who go to the emergency, to the residency training, they are allowed to have extra shifts. And most of those shifts are in emergency departments. So the knowledge that we have to share with them, to construct with them, is really important for the patients in Brazil, right? So at the end, we were able to select 5 supervisors, and that was our job every day. Around 100 consultations, around 120 patients in observation, and we need to take care of 24 residents and 16 last year medical students. That was in 4 different places, right? So that was the challenge. So what can we do? So we decided to start to study medical education. We have this feeling, physicians in general, that we can immediately become teachers. As soon as we are good doctors, we really believe that we can immediately become good teachers. And now I am very sure that's not the case. It's a different identity, it's a different profession. Yes, it's similar to take care of a patient, is similar to take care of a student. We can make a lot of parallels, but it's not the same job and it's not the same identity, it's not the same mindset. If I am in the morning and I see that a resident was not able to recognize an infarction, I immediately go like, but that's not the behavior of a teacher. I cannot behave like that as a teacher. I need to understand the process of learning to have an intervention that will help the students. So first of all, we decided to create an assessment because I was seduced by this idea that assessment drives learning. So let's create a test. And then we decided, that is the format of our rotation. We have 2 months. In the first month, we have one, at the end, we have one assessment and a second assessment after the second month. And our assessment is very comprehensive. We have a cognitive test, we have OSCE, we have direct observation of clinical skills, we have assessment done by the patients in terms of the communication of the doctor, we have assessment by the multi-professional team, nurses and physiotherapists, we have self-assessment, and we have peer assessment. So it was a lot of work, but the assessment was okay. But at the end, students were engaging with the assessment, because that's what the students do, right? They want to pass the test. So they were engaging with the assessment, but they were not engaging with us. And then we decided to work with this concept of educational alliance. Some people are making a parallel between the therapeutic alliance with the educational alliance. So if you go to psychologists, to the world of psychology, it's more important the relationship with your psychologist than the methods that the psychologist decides to apply with you. So the relationship is the core element of the outcome of the patient. And we believe, this group of physicians that work together in Brazil, that the relationship with the student is the core element of the outcome of the educational process. So all our activities were based in this idea. We need to connect with the students. And then there is this first challenge, right? I look at Neymar, but I want to see Pelé. But then I see Neymar that is all the time crying and I don't know. I don't like Neymar, but I love Pelé, right? And with the students it's the same. I look at them and I have some expectations in my mind, maybe fake expectations, I don't know. But I have these expectations that they will behave in a certain way. But then they behave their way. And then there is a lot of frustration in my side. And I have to deal with this frustration to be able to connect with them. And I think that dealing with this gap is searching for what we have in common. We are the parts of the society who decide to take care of the others. And I really believe that we can get this as a common ground for starting a relationship with our students. But how? So I was in the ward in the morning, and then one of the clinicians, one of my colleagues came to me and said, Marco, we have a problem today. I said, okay, what? It's a patient? No, the students are fighting. Okay. They're fighting in the email group. They're saying a lot of bad things to each other, and I think that the round today will be a nasty one. We have to get prepared to deal with them. Okay. And then I started the round and everything was normal. They were like polite, talking to each other, and then we realized that the real students were at home playing the avatar game, something like that. The real students were the ones that were online, interacting online, and we were dealing with those guys that were not the real students. Because those guys, they communicate better online than on site sometimes. If you take a moment to think about it, communicating online is quite safe. For instance, if I tell a joke online, I can frame your reaction by putting a smile face, an emoji, on the message, right? It's a way of framing your reaction to my joke. In real life, if I tell a joke, you can get angry with me if you don't like the joke. Because jokes are risky, right? Communication is risky. Every now and then we face something that people understand completely different. And we have to deal with this. But online, you can frame the reaction. And you have more time to decide what is the reaction that you're going to have. For us, it's not safe at all because we cannot find the right emojis for the right emotions that we want to frame. So I'm not telling you that go online and start talking through emojis, because maybe for you it's not going to, maybe for the young ones, but not for the people my age. But for them, it's quite safe to interact there. And they are doing everything online. They're dating online, they're studying online, they're doing everything online. But at the same time, the online environment is a kind of trap, because when you get there, lecturing is quite challenging in the online era, because if you check your cell phone right now, you are not going back to me, because there are so many interesting things to do online, much better than to listen to a bold guy talking. So it's risky, because you can go there and we can lose them. We can lose the students when they go online. But the idea here was to use the online environment as a bridge to get them to our environment. That was our challenge. We want to go online, but not to stay there, to get them back to us. That was the idea. So we decided to develop this online platform based on some learning theories. You don't have time to go deeply on that, but we used the cognitive load theory and the self-determination theory to develop the content of the platform. And we decided that the platform would be for fun, no grades involved. So we are not grading them for the online activity. We already have lots of assessment. We don't want to use the online environment to grade them. And then we developed several strategies. One that I like the most is the virtual rounds. So virtual rounds are a real round online. So every Monday, we start a new clinical case. We have almost 700 cases online right now. So we start a new case. It's based on a real case. We give information, and we ask a question. And then they interact during the day. In the second day, Tuesday, I give the answer for the question, more information, and a new question. And it goes this way until Friday, when we close the case. So what we are doing is that we are giving time to them to answer the questions that we ask in a real round. But in the real round, the cognitive load is so high that they cannot properly interact with the questions. But online, they have time. They can do that whatever they want. Even when in the line waiting for the cinema, for the movies, to go with the girlfriend, they can start doing something with that, right? And the most important, we have ways of solving the problems that follow always the same step. So those steps are not explicitly shown for them, but every time they solve a problem of a patient with chest pain, we will follow the same trajectory. Dyspnea, same trajectory. Whatever, same trajectory always. So they can internalize this process of reasoning. We also have what we call emergency quiz. Those are multiple choice questions with immediate feedback. So when you press the button, if you were wrong, we say why you were wrong. If you were right, we say why you were right. We have extreme decisions. Extreme decisions are problems with 12 steps presented as consecutive multiple choice questions. So to get to the second, you need to be right on the first. And again, we have immediate feedback. So if you're wrong, why you were wrong? If you're right, why you were right? We have AKG challenges. So every week, we put online a case that we give information, the AKG, and we ask some questions. And then after 1 week, we have feedback. We do the same with radiology exams, like X-rays on tomography or MRI. We put the problem, they can interact, talk to each other online, and then after 1 week, they have the solution of the case. So what happened? It's not obligatory. That is the average per student. They do 1,300 page views. They stay online 56 hours in 36 access, right? I used to give lectures every day at 6 p.m. It was a lecture to solve cases. Before the platform, I had always full house. After the platform, there were 3 or 4 students, and I could see that they had a kind of schedule, just not to embarrass me. They're going there just to please me. And then I said to them, you know, maybe it's time to cancel the lectures. And then, yeah, maybe. And then lectures canceled. We published these, but we were not satisfied yet. So we had a next move. The next move was trying to build a community of practice, right? So community of practice is the theory of the learning communities. That those are those groups of people that they work together in the same profession, like builders, clinicians, teachers. They share a practice and they share an identity, right? That is the definition of community of practice. They have a shared practice and a shared identity. And this identity is built through 3 psychological processes. One is imagination. You have to imagine yourself as a member of the team. You have to engage on the activities of the team. And you have to have your values and goals aligned with the values and goals of the team. So when a student, a medical student, enters medical school, that's what we want them to develop. We want them to become doctors, to be part of this community. But we don't address those elements explicitly, right? So the idea was to connect those 2 communities that are already in place, the community of the students and the community of the teachers. And how? The how is we create a Facebook character. Because in Brazil, Facebook's like used for 95% of the students. 2 years ago, we had to migrate to Instagram because students are not using Facebook anymore because now the parents are using Facebook. So they are using Instagram. So we have also an account in Instagram right now. But the idea of this character was to have the better of each one of the teachers. We want this guy to be a funny guy that would send daily message to the students to remember them to study. So you were there in the canteen waiting for your meal, and then you get a message from this guy saying, time to study. Why are you wasting time? And then you can go online and see the activity of the day. We would like to decrease the cognitive load of navigating the system, and we also use the self-determination theory. So this is the guy. In Portuguese is já sinto bem melhor. It's like feel much better. In English would be that way. And this guy sends daily messages to the students with the activity of the day, because we have new activities every day. So they get a message. That is the activity of the day. And then they can go direct from Facebook to the activity that they have in that day, right? But Jacinto also is concerned about identity. So Jacinto creates a lot of visual things to create identity, even lists on Spotify. So if the students want to know what is the kind of music that I like, I have a list of music in Spotify because Jacinto organizes the list of music of all the teachers in Spotify. We have these products that we pretend that we sell. We don't sell for real, but we have Game of Jacinto, we have Jacinto Wars, we have Jacinto everywhere. Facebook once decided to shut us down because we did not know that you could not have a fake character on Facebook. So they realized that Jacinto was fake. But then the students spontaneously start to mark Jacinto in pictures all around the world. So Jacinto went to every country in the world right now. China, Europe, other countries of South America, Africa. So Facebook's not trying to shut us down anymore. But now we have a page, so we are following the rules. It's quite difficult for a Brazilian to follow the rules, but we are doing our best. So that's what students find of it. It brings motivation, is useful, interact with teachers, fun, creates a sense of community. So that's one of the statements of the students. Phil is our partner, our friend on social media, transforming learning something funny and natural. It's an example of how study became more dynamic and enjoyable. That's what happened with the numbers. We went from 1,300 to 1,900, from 56 hours to 85 hours, and 36 access to 45. I need to tell you that our students already have 11 hours of contact every day. They stay with us from 7 a.m. to 6 p.m. every day during the rotation. So it's extra time. Maybe it's too much. I will come back to that later. But we are not replacing on-site activities for online activities. The online activities are extra. They have 11 hours of contact. But then we had this new problem. The number of activities was quite high. So how to deal with that? Then I was in the airport. I always have to buy books when I am at the airport, so I bought this book about gamification. And I was reading this book about gamification and learning. And I was like, well, we have this very boring activity of journal clubs. Do you have journal clubs? Journal clubs, all the students are sleeping. The student who is not sleeping is the one who is presenting, right? And maybe also the teacher is sleeping sometimes. So we decided to transform the journal club in a kind of competition. So we have like 2 papers and the students have to read, and then we randomly select groups and they have to play with each other. And at the end, they have to ask questions about the papers to each other. And at the end, we give good chocolate for the winner and bad chocolate for the loser, but chocolate is always good, so everyone is happy at the end, and the students are happy. And then we make these available on Facebook. But then we decide, well, we publish that, and what can we do with our content? So we decided to create 3 medals: Emergency Cool, Emergency Pro, and Emergency Insane. And those medals are just a way of organizing the content. So if you decide to go to Emergency Cool, you start with level 1, 4 activities. And then you finish level 1, I open level 2 to you. And then you finish level 2, I open level 3, and so on. And then if you finish 101 activities, you will earn this medal. And then you need to continue, right? And then you go to Emergency Pro with 153 activities. And then you go to Emergency Insane with 216 activities. And that's what happened with the numbers. Just because we have a study guide with a medal, right? It's very simple. 140 hours just because you will earn a paper medal. It's crazy, right? I never played a game in my life. Like, I hate video games and all that kind of stuff. I had this friend, he had a video game, but there was a goat in front of his house, and I would prefer to fight the goat than to play the video game when I was a kid. So I really cannot understand that. But that's what happened. But most important, that was happened with the baseline study. So that is the curve of study of the use of the platform before the test. So the assessment day is on your right. And that is the baseline. That was what happened with Facebook, and that was what happened with game. And we already know that the baseline study is the study that's most important for long-term retention. So with the gamification strategy, they are studying more constantly. That is what is important for us. Maybe now we have to have more assessments with lower grades, because now we think they are studying too much. So there is a correlation between the grades in the cognitive test with the utilization of the platform. There is also a correlation between the OSCE and the utilization of the platform. It's not a cause-effect relationship, of course, it's just a correlation, but we observed that. And the average grades enhanced because we used the same assessment strategy for the game, for the face and game groups, and well, the grades are better now. So that's the opinion of the students. We have guidance, usability, we have the sense of competence, it's fun, motivation, we have pride when we earn medals or when our friends get medals. That's a statement of the students. For a generation that has often been shaped by video games or missions within RPG games, see a study platform following these modes is a great incentive to feel part of it and complete its steps. Encourages us to try to always go a little further. It's also published, so at the end, if you want, I can send the email with the publications for you. So what we understood with this, that assessment drives learning, but engagement also drives learning. And it's funny. And it's not fun, it's funny not only for the students, but also for the teachers. We are more engaged in the activities because the students are more engaged. Because engagement is this dual process, right? If you engage, people get more engaged, then you engage more, and then people get more engaged. So it's a positive cycle. It's a positive feedback loop, engagement. And that's one thing that we should all try, I believe. But then, we are from Brazil, so at the end, we had to create this celebration to give the medals, right? The best player is at the right. This guy is really good, really good. This old guy, not too old, was the dean of the University of South Carolina. He was visiting us, and then we told him, you know, we cannot have dinner with you today because we have this celebration with the students that we are going to play. We did not know that you would be here the same day. And okay, so do you play rock? Yeah, we play. Do you know this music of Rolling Stones? Yeah, we know. So maybe I could play with you. And I said, okay. And he was for 20 years without playing the drums. So he was really funny at the end. So music has this power, right? I work in a research group in the University of Groningen now. And I brought some Brazilian PhD students that are working with me in medical education. And we call that Brazilian Week. It was after Amy. And then we had a music session there. And they did not know that almost all of them were able to play an instrument, but they did not know that about each other. That's crazy, right? They were working together for 10 years, 12 years, 15 years. They all play an instrument, but they never play together. I cannot understand that with this Latin America, South American way of seeing life. It's quite difficult for me to understand. And then they were really happy at the end. And this is the power of having this feeling of community and sharing more than only work. We can share more with each other and also with our students, more than work, to help us to create meaning of what we are doing every day. We do a hard job. To be a teacher, to be a university teacher, a clinician, it's a hard job. So it's very important to have a relationship of meaning with what we are doing, and we could help each other to create this relationship of meaning. And sometimes I think that we are so stressed about work that we are missing opportunities to help each other to create this kind of relationship. Because at the end, we want to engage those students in this community. We really want them to develop this professional identity of being a health professional, of being a doctor. We want them to feel that they belong, because when you feel that you belong, you also feel responsible, and we need students that are who are feeling responsible for the healthcare system. We are facing threats right now that we never faced before. The costs are increasing, the workload is increasing, the societal value of our work is not the same anymore. So we need them to take over, right? We need them to replace us. And then they have to develop this identity, but we have to create opportunities for them to develop this identity. I think that just sitting down and waiting for them is not enough, so we can help them to imagine themselves as a doctor, to engage in activities, to have this alignment of values for that to happen. We have to be explicit about that. And then my proposition for you is, let's go to their world to understand their needs, to understand their ways of seeing the life, so we can bring them back to our world. Because we also have a lot of things that we need them to understand and to take care. But maybe if we feel that being a teacher is an identity itself, and we are committed to the outcome that is providing good education, and if for providing good education we have to understand this new generation of students, so maybe that's the way to go there, to understand what they need, who they are, and then try to convince them to come back to us to take over the societal mission that we have, right? That was the message. Thank you very much.